Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's talk about your jaw and TMJ. And before we jump in, I'd like to quickly remind you about my website, teethtalkgirl.com. If you're ever looking for a specific dental topic, I have a search bar where you can easily find what you're looking for, and also my Instagram at teethtalkgirl. So TMJ, also known as a temporomandibular joint, is something that everyone has. It's a hinge joint on either side of your mandible, which is your lower jaw, where it connects to the rest of your mouth. Unlike most hinge joints in your body, the TMJ is actually double hinged, so it actually moves in all sorts of directions, not just up and down and side to side. You literally use your TMJ to go in every direction possible when you're chewing food. And I just want to reiterate how everyone has a TMJ, because lots of my patients say to me like, oh, I have TMJ. If you say it like that, I know what you mean. You're referring to TMJ pain. But just so you know, TMJ actually stands for the joint itself. It does not mean you have TMJ disorder. TMJ disorders are commonly referred to as TMD, temporomandibular disorder. And TMD and jaw pain are things that can flare up at almost any time. If you're someone who has chronic pain in your TMJ, or if you have a limited range of motion, how wide you can open and close your mouth, then you know how it can affect your diet and lifestyle. So what causes TMD? TMD can be caused by a number of different factors. Some of the most common are 1. Bite misalignment. Who knew that crooked teeth could lead to TMJ pain, right? But when your bite doesn't line up properly, it means that your TMJ has to work in an irregular manner to chew food properly. All those weird movements can gradually lead to joint problems. 2. Bruxism. Bruxism is another word for clenching and grinding your teeth. Chronic teeth clenching and grinding can lead to excess pressure and overuse of your TMJ on either side of your mouth. Ultimately, all of that tension from biting so hard can strain the ligaments and muscles that allow your TMJ to move. 3. Arthritis. Deterioration of your body's bone cartilage doesn't just affect joints like the ones in your hands and your knees. It can also cause TMJ pain. And 4, physical trauma or injury. Something like an automobile accident or athletic injury can be hazardous enough that it permanently damages the internal ligaments and discs of your TMJ. How can you tell if you have TMJ disorder? Some of the first things to look for will usually involve signs of headaches and ear pain and tooth pain. Since your TMJ is located immediately next to your ears and the muscles that attach to it spread elsewhere in your face, head and neck, and your teeth, it's common to feel TMJ pain in other areas of your body other than the joint itself. Popping and clicking. Are there audible noises coming from your TMJ when you open and close? Occasional popping might not mean anything, but if you notice a pop or click every time your mouth moves, be sure to let your dental provider know. Joint stiffness. Some soreness and joint stiffness might flare up now and then or become part of your everyday life. Pay attention to whether your symptoms are more noticeable at certain times of the day, such as right when you wake up, which can also be signs of clenching and grinding while you sleep. Limited range of movement. When we get stiff joints, they just don't move as well. It's the same for your TMJ. If you have TMD, your mouth might only be able to open half of what it did years ago. Doing something like biting into an apple could be physically impossible. Joint locking. In super rare situations, symptoms can include your mouth locking shut or open, where you can't move it at all. Obviously, this can be really scary and requires immediate attention from someone like your dentist, an oral surgeon, physical therapist, chiropractor, or a medical doctor. And lastly, atypical anatomy. This internal TMJ symptom is one that your dentist will need to check by taking a panoramic x-ray. If the joint is starting to deteriorate or there's structural damage because of disease or overuse, it can show up on your image. When to see a dentist. If you're to the point where you can't eat normally, are dealing with pain on an everyday basis, or you're Googling things like TMJ pain relief, then you're past the point of needing to see your dentist about your condition. Your dentist can screen for atypical joint issues to see if TMJ treatment is necessary. In most cases, they can help you without referring you elsewhere, but occasionally your dentist might send you to a specialist, such as an oral surgeon, orthodontist, or to see a physical therapist. If you'd like to learn more about TMD treatment options, such as night guards and orthodontics, or pain relief, such as as TMJ at-home exercises. I'll link my other TMJ videos in the bottom bar below. But in all, just remember that everybody has a TMJ, but only some people have TMD or TMJ disorder. If you are in pain or can't open and close your mouth normally, see your dentist for a routine exam and make them aware of any symptoms that you're experiencing. They'll screen you and recommend the most appropriate treatment. Just don't wait until the symptoms are so bad that you can't eat. I hope this video helped you. Please like and subscribe if it did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, for more articles and videos about healthy mouths and healthy teeth. Peace, love, and teeth.